And action. Haley wanted me to talk about tobacco cessation. And tobacco cessation is a tough topic. And just for full disclosure, I used to smoke when I was in the Philippines. It was Marlboro non-filtered blue labels. And it wasn't for long, but there was definitely a social aspect to it. Going to a bar, smoking, having a San Miguel beer, and just having a fun time. There's a learned behavior there. So some of us, even if you don't like tobacco in high school because of peer pressure, if you experiment with it and you associate it with the good times back then it might be tough to get rid of, especially if you rely on that vehicle to give you those good times again. And you would think that, well, the nicotine shouldn't cause that many problems, but remember, that's where the mind is very powerful, because when you get that nicotine hit, it attaches to muscarinic receptors in all your cells of the body, but it has a specific stimulant effect to give you a reward, and the reward makes you feel good. Just to prove the point, if you see anybody in the dead winter of Chicago huddling in the corner outside of an establishment, even a hospital, you'll see them kind of smoking the cigarette, and you wonder, man, it's freezing outside. Why are they standing out there smoking? It's because, number one, your body gets used to having that chemical in you, and it also gets used to having the reward given to release that chemical or to release another hormone. And then there's finally the behavior of feeling something in your fingers, feeling the first inhale when you smoke. It's almost like the breath exercises that I suggest on DrRic tutorial 478 breath. Talk about taking a deep breath in, holding it for about 7 seconds, and then letting it out over 8 seconds, 478. So there is something that the body experiences, therapeutic response, a hormone release, when you do concentrate on breath, holding, and have a pattern. Same thing with the cigarette. No matter how quick you are or how much anxiety you have, you gotta drag through that little filter, and you can't force more air through. I see some people they puff, but usually to get the best drag and get it to the bottom of the lungs, you have to take that slow, deep inhale in. So I'm not saying it's therapeutic, but I think it's a learned response that's associated with a reward system that is a bad setup. And I do believe that the tobacco industry knows that. My suspicion when I talked to somebody that worked in the industry was that there were trace amounts of 3 different things. Arsenic was one of them that in small amounts won't alarm anybody that it's a poison, but in combination, the cocktail really had a reaction that makes you want to have it again. And that's the same kind of adjuvant that you find in vaccines. I'm not saying it's exactly the same compound and exactly the same formula, but in a vaccine you have an adjuvant in addition to your vaccine, your killed virus. It used to be mercury, but we've taken out a lot of thimerosal to stimulate the body to attack the virus and develop antibodies. Well, I think my theory is that you find the same thing in tobacco, the tobacco leaves, in addition to the nicotine. The big problem in the tobacco and tobacco leaves is you also have tar, which I've mentioned on my videos on marijuana and CBD, that if you can avoid the leaf with regards to smoking marijuana, you might have better results, assuming that the tar in the leaf will also be giving you eventually a cancer possibility. Well, the way we translate that in tobacco use is if you have a pack a day and you smoke for 20 years, you really are high risk, and you should be getting a CT scan of your chest, which is actually approved by most insurance companies because your risk for cancer is high. And if we can get you to find the cancer early, then you're better off, and you'll fare well as far as the treatment plan for it, which is a nasty conversation, but those of you who smoke know how tough it is to put it away. And even though you might have stopped or quit cold turkey in the past, most of the folks that I know that quit cold turkey go back to it. And even if you were cold turkey and you're off your tobacco for 3 to 5 years, the fact that you went back to it means that the cold turkey didn't work. So anyway, some of the things that we'll talk about that you'll be able to find actually on some good websites. This is Illinois Quit. It's called quityes.org. Quityes.org is what Illinois has put together to help us, or help people, stop tobacco use. In addition, we have with Advocate Good Shepherd in Barrington, Illinois, we have a tobacco quit program that you can sign up for a nominal fee. You pay for the instructor, but the studies have shown that if you have a quit program, the chances of long-lasting, sustainable success off of tobacco are higher. So just going cold turkey, fine. You don't have to hire anybody. You don't have to buy anything. But the likelihood of success, long-lasting, is low. And if you're going to get off tobacco, even if you started when you were a kid in high school, it's going to be a long process. We want to make this investment in your stopping a long-term investment, a lifetime of investment. So it's worth it to try to load yourself up with the most successes as possible. So in addition to having a counseling group or somebody that you even see once, like the guys over at that run the tobacco quit cessation program over at Good Shepherd, even if you see them once and you just follow up with them by phone afterward, it still is important to consider other avenues, and these are the other avenues I'll talk about. But before we get to that point, if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I put new videos out. So what do we have available? Well, first off, the reason we have the dependence on the tobacco is the chemical dependence. And nicotine does cause a scientific reaction, gives you a sense of wellness, but it is fleeting. So what happens when it goes away? Well, you want to have another cigarette. So there are things you can do to at least take care of that nicotine part, the dependence on it, the crave for nicotine, and that would be patches, gums, inhalers, lozenges. So there are things out there that have nicotine in them. The patches are good. The only problem with the patch is that at 3 different doses that you can find over the counter, they give you continuous nicotine, low and slow, all day long, if you wear the patch all day. If you take the patch off at night, that's fine too, but that's not the way people smoke. People smoke, they get a hit, and it falls in the bloodstream. Then they take another hit later on, it falls in the bloodstream. So it spikes and drops. And some people might have used it after they eat. Some people might like to use it after sex. Some people might like to use it if they get tired, when they're finished their studying. So different people use it at different times. So when you have a patch that's on you continuously all day long, it doesn't give you the same response. Gums are sometimes nice because you can use a gum and chew on it at the time that you usually would rely on your hit of tobacco from your cigarette. Now, the only problem with gum is that you're chewing, it might not be too great for your gums, and whether you chew gum that has nicotine or whether you have a smoke and you expose yourself to the tobacco leaf that will give you oral cancer, like in a cigar. So cigars give you oral cancer, but since cigar smokers don't inhale, the likelihood of lung cancer is lower, but lip cancer is high. So this is why this stuff is so bad for you. However, a gum, so the gum has nicotine in it, you chew it and it gives you a burst. You get it through the saliva, it goes in the blood vessels underneath the tongue, and then you get this big hit, sudden spike. You spit the gum out or you continue chewing it, it's up to you. But you might get a little saliva irritation, and then whatever's in the gum to make it palatable, usually it's going to be a sugar substitute. Might not be too healthy for you, but there are gums available. There are also inhalers. Back in the 90s, I used to prescribe something called Nicotrol inhalers. They're plastic inhalers that look like a cigarette, even to the point where the brown part that was closest to your lips was where you put the canister, and the white part was just the filter. Well, you put a canister in there that has nicotine in it, you take a drag, you hold it if you want, and it gave you the psychological feeling that you had a cigarette in your fingers. Obviously it was plastic, so it felt different, but the nicotine that was in there lasted for a while. I tried it before, and it was very dry. So a different kind of reward when you tried to do the inhale, the drag in, but it gave you a nicotine buzz whenever you wanted it, and you had this thing in your hands. So that's how important it is. Before I go on to the lozenges, that's how important it is to have a psychological fix, because when you're used to having nicotine, whether in whether in holding the cigarette or feeling the cigarette or lighting the cigarette, hitting the lighter, whatever it is, even just having a pack and tapping the pack down so you compressed all the tobacco into the cigarette, if you're used to that stuff and you don't have it as a habit, that'll be the other thing, because we have habitual things that we go through all the time, and when you don't do that, it tells the brain, wait a minute, I wasn't allowed to do that, I'm going to want to do that. So your brain will search for a substitute. I remember in college sometimes biting a pen cap when you're trying to stop, or eating carrots. Something of an oral fixation made you not think about having the cigarette out of your arm's reach. But then that's also why a lot of people will gain weight. Usually if you stop tobacco, there's an oral fixation we go through. I don't think it's just because we're trying to satisfy something touching the lips. I think it's because there's definitely a shift over to satisfy. The craving is shifted over to food. And certainly gaining 10 pounds to 20 pounds isn't healthy, but as a substitute for getting away from tobacco, we can deal with it. In fact, I tell my patients, try to lose weight before your quit date, because you're going to gain a little bit of weight. And then when you gain the weight afterward, we won't be so guilty, or won't have to step on that problem later on. But I can always help you get rid of the weight later. So either way, obviously there's an oral fixation you have to take care of. There's a nicotine fixation that we have to kind of allay. And then there's other things too. For whatever reason you started the nicotine, whether it was getting through a divorce, going through high school, going through bullying, losing your job, we also have to use positive psychology, biofeedback, mindfulness practice to calm. Because if you're asking for a stimulant, that's one thing. If you're asking for something to calm you, which nicotine does, it calms and settles, and you don't have that anymore, you might switch over to a medicine, or you might switch over to alcohol. That's not cool. Switching over to medical marijuana, THC at night, well, I don't think that's too bad, but we don't want to just snow an anxiety issue. You want to address it properly. So calming practice is always the cheapest and easiest, most reproducible, without any cash kind of thing to do to calm the mind down. And most of us do need that anyway. Most Americans don't have a mindful practice, a calming practice, and I think if somebody can teach you a meditative aspect or meditative practice, or if somebody can also teach you how to cook properly, since you're going to be probably diving into eating as an option, then that'd be great. That would be 2 steps into the direction of healthy lifestyle change, in addition to exercise, which will be important too. So bottom line is lozenges, all these things help. Lozenges do help as well. Lozenges are a little slower to work. You gotta suck on them, you gotta melt them in the mouth, and then there's a taste there that there's probably gonna be more sugar in that stuff, but not so good for your dental. Not so good for your dental visit. You might have to get checked beforehand. And anybody that smokes or uses cigars, you always have to have an oral checkup with a dentist once a year, even if you don't feel anything. So finally, there's medications that we can use. And the medicines that we use are mostly to calm the brain down. Wellbutrin is a medicine that's used to calm the brain down. You use it in anxiety or any kind of mood abnormality, and it has shown to be helpful with addiction issues. But in calming down the brain without gaining weight, Wellbutrin's perfect, twice a day usually, but that's a prescription. There's also other prescriptions that can be used to calm the brain down, and that would lead me to my last issue. If you do have a medical disease, a DSM problem, a psychological problem, anxiety, depression, bipolar disorder, manic depressive, personality disorder, if you have something like that, or even if you've just been abused, bullied, then you should have that treated first. You should see a psychiatrist for the diagnosis, or a psychologist for the diagnosis, and then you have the treatment plan for that. Because if you used tobacco or any other substance for that matter to calm down the feelings from that abnormal behavior or that unsettled feeling, well, when you stop that rescue, you're going to have that feeling bubble up again. So sometimes it's important, if you're curious or if you have symptoms, then it's better to have a diagnosis. Sometimes the primary care guys can do that. Sometimes we'll have to get more detailed with a psychologist or a psychiatrist. So that's always another feather in your cap to have on your team, another person to have on your team to make the chances of sustainable success higher. So we have the substitutes for nicotine, we have the substitutes for the oral fixation, we have the calming effect, the possible programs that you can go to or look for quit programs. Even Philip Morris has on their website a link. It's real tiny and you have to keep on clicking to get to it, a quit program and a couple of things on how to stop tobacco, a tobacco cessation program. Again, Illinois is pretty good with what they have to offer. There's a lot of other programs that are out there. If you search on the the Advocate Good Shepherd website for the tobacco cessation program, you'll see a lot of links, a lot of good things, even goes through what happens in the first 30 minutes to the first 2 years to the first 10 years of staying away from tobacco and all the benefits. It's really cool. So hopefully, Haley, this helps. There's certainly other reasons and other things that can probably help you with getting through to tobacco quitting time. I'd always say having a partner join you on the same journey would be more encouraging, and both of you, because if you try to get rid of it and your partner's lighting up, you're constantly exposed to that. That's kind of like having a gambler that's trying to stop gambling go with his partner to a casino. It's not going to happen. Your chances for success, even if you're tough like that, chances for success are low. And we're going to load up and stack up the odds for success more so than just adding a couple of good possibilities here and there. Load them up, do everything you can. I'd say if it's affordable, do as much as you can, plan on it, have a quit date, look up to that quit date, something significant, work up to it, get excited, start an exercise program, get into a mindful practice, start looking at different foods, start to trim down. That way when the time comes, you might even just with those 3 things, exercise, nutrition, mindful practice, you might even be able to just say, I don't want the tobacco anymore because it doesn't serve me anymore. Sometimes that's enough balance in itself. So hopefully this helps. Good question. If you have any comments on the way you guys might have been successful with your own adventures, please put them down below because I'm sure other people will be able to get the same benefits.